Are you suffering with neck pain and wondering if you have neck arthritis? Or maybe you even went to the doctor with neck pain, they did an x-ray and they told you that you have neck arthritis, and that's what's actually causing your pain. So you may be wondering what's going on, or do I have neck arthritis, or what are the next best steps if you've been diagnosed with neck arthritis or think that you have neck arthritis. So that's what we're going to talk about today. I'm Dr. Amy with Physical Therapy for Everybody, and I've had a lot of patients coming in recently who have had neck pain, they have gone to the doctor, they have had an x-ray, they have been diagnosed with neck arthritis, and the doctor said, but there's nothing you can do about it. And they're frustrated. So this video, my friends, is for you. If that's you and you have been in that situation and you are confused about the next best steps, that's what we're going to talk about today. So first off, I'm going to explain what I tell all of my patients who come in who have already been diagnosed with neck arthritis. In general, neck arthritis is very normal in today's society. Now, I'm going to explain more about that later on in this video, but it is very common. In fact, I have never seen a patient who is over the age of 40 years old who didn't have some neck arthritis. So if you've been diagnosed with neck arthritis, congratulations, welcome to the club, especially if you're over 40, because it's actually kind of normal or common. Now, just because it's common doesn't mean that that's the way we're supposed to be. You see, every tissue in your body is designed to heal itself as long as it's moving correctly, which means arthritis should never actually happen. However, as we're going to discuss later, there's very many common factors that come into play when we're discussing neck arthritis. But in general, what neck arthritis is wear and tear on the joints in the neck. So you see, in between the vertebrae, we have these joints, they're called facet joints. It's where one vertebrae communicates with the next vertebrae. And what happens is that they get this wear and tear, or the cartilage that's supposed to help everything glide breaks down, and then the joints start kind of jamming into each other. Well, the body doesn't know what to do about that, so it lays down some bone, which is what neck arthritis is in the long term. Now, you can have an inflammatory stage before that where the cartilage is just kind of wearing away and it hasn't truly become an arthritis yet. But in the end, if you've been diagnosed with arthritis, that's what it is that there's abnormal bony formation in the joints. So people ask me, can you do anything about it? Now, there's no way to get rid of arthritis once it's formed, so the primary goal is to keep it from forming in the first place. If you already have been diagnosed with neck arthritis, then the goal is to keep it from progressing any further. It's really important, especially if you've had a diagnosis of neck arthritis that's mild right now. We want to do everything we can to improve your biomechanics and decrease the stress to that joint so it doesn't progress. Because when neck arthritis becomes severe, it becomes severely limiting in your range of motion, as well as causing a ton of pain. All right, so why do so many people over the age of 40 have neck arthritis? Well, you see, as we age, the discs that are in between the vertebrae, you may have heard of the discs in the lumbar spine because they get herniated and they cause sciatica type symptoms and stuff like that. Well, we have them throughout our spine and we definitely have them in our neck. So over time, because gravity is pushing down on the top of our head, we will tend to lose disc height over time. So maybe you know, like your grandma lost 3 inches in the last 10 years of her life. Well, that's because of the disc height. She did become shorter, but that's the reason why, is because of the disc height. And another thing that definitely impacts us in our society today is our posture. We tend to be in more of a forward bent position because we're looking at our phones, maybe we're reading on our Kindle, or we're on the computer. We tend to be in more of this forward head posture, and that puts a lot of pressure on those discs. It also causes a lot of pressure through those facet joints, which are the joints that are in between the vertebrae. And when they get pressure, the cartilage starts to wear down and arthritis starts to form. The other thing that I commonly see in the clinic is that a lot of people have been involved in motor vehicle accidents or had some form of trauma. And if this happens when you're young, you tend to think, it's going to be fine. You may not even get treatment for it. Maybe you did go get some x-rays just to make sure nothing was fractured, but after a couple weeks, you were able to get back to all the things you wanted to do. However, if that trauma is not properly healed, it sets you up for a long time, lifetime issue. And that's what I commonly see with people who have neck arthritis or any kind of neck pain, that they were involved in some kind of traumatic accident when they were younger, and they never got treatment for it because it just didn't seem like it was indicated. And if you're over the age of 40, you probably know that all of those things come back to haunt you later on in your life. So if you are struggling with neck arthritis now, I encourage you to think about, was there a traumatic incident? There may have been more than one that caused some of that neck pain at the time that seems to have resolved. And I would propose to you that that may not have healed 100% correctly and may be contributing to your problem now. Now, why is that important? You can't go back in time. We don't have a time machine to go back in time to fix that problem. But it's important because you need to work with your specialist and let them know about this, that there is some chronic long-term trauma in the neck. It's important because then we know how long things are going to take to heal. If you have a long-term chronic issue, it's going to take longer to heal than if you just got in a motor vehicle accident a week or two ago. So it's important for you to know your medical history and discuss that with your specialist, because then they're going to be able to help create the best plan for you. Now, the other thing that comes into play is general systemic inflammation. Now, we can have inflammation specifically from a traumatic incident or something that happened previously, but many people today are struggling with general systemic inflammation. And what that is basically your whole body is inflamed. This may express itself as swelling. It may express itself as just feeling puffy. You may have all of your joints are really painful, and you've probably been to the doctor and tried to figure out what's going on, and they've done all the tests and they can't figure out anything in particular. It may be just a general systemic inflammation. Now, if this is you and you're like, yeah, I have neck pain, but I have pain in every joint in my body, and I've already seen the doctor and they've already told me that there's nothing wrong, then this is probably you. What you want to do in that case, if you're suffering with general systemic inflammation, is make sure you're drinking enough water so you're getting that flushing happening through your body. You want to make sure that you're avoiding processed foods or foods that are high in sugar, because that increases the inflammatory load. And you want to make sure that you're doing cardiovascular exercise. Now, that could be walking, it could be running, it could be the elliptical swimming, whatever you enjoy doing and is easy for you to do regularly that you enjoy, because if you don't enjoy it, then you're not going to want to do it. It is important because it helps to deal with the systemic inflammatory load throughout your whole body, and that will help make your neck feel better too. All right, we're done with that rabbit hole for now. Back to neck arthritis. So a couple more things that can be causing neck arthritis is that the muscles can shorten over time. So muscle tension causes compression of the discs, which leads to that facet joint irritation. And what happens is that we just tend to pile stress upon stress upon stress that increases that muscle tension. In addition to that, we're sitting in this poor posture throughout the day, or maybe even standing in poor posture if you have a job where you're standing all day. I know I have this problem too, because I'm standing and working on bodies all day. And so I have to be very careful about the position my neck's in, because I can, by the end of the day, I can be like bent over like this. And then I got to type my notes, which, you can imagine how well that goes on a computer when I'm already stuck in that posture. That's why it's so important to make sure you keep your flexibility. If you start stretching on a regular basis, it helps you to know when things are a little bit tighter than normal. But it also helps to reset that baseline, which is so important to make sure that each day you're waking up refreshed, ready for your day, stretched out, flexible, decreasing the pressure to the joints. All right, so I wanted to share with you a story that I hope you'll find very inspirational about one of my former patients, Sue. So Sue came in to see me because she had been to see every other physical therapist for her neck pain. She did not know she had neck arthritis at this point. She had not been diagnosed with it. But she was in her 70s and she had neck pain. She had been to see every other physical therapist and they all had her doing these exercises that made everything worse. So during my evaluation, I do not have x-rays, but I use hands-on techniques and very specific tests. I was able to tell that she had a pretty significant case of neck arthritis. Again, she was in her 70s, so this is not necessarily considered unusual. Because of that, I changed my treatment. We did less exercise specifically for the neck. We did more things like stretching and breathing and posture, encouraged her to do cardiovascular exercise, which she did daily, and we were able to eliminate her neck pain. So Sue stayed on my schedule once a month. She would actually come down here and see me. We would do some treatment and get some hands-on to get things to loosen up, and then she'd be fine for the next month. So this went on for years. So I saw Sue until she was in her 80s. Now, when she was in her early 80s, she was involved in a pretty bad car accident. She was hit from the side in the passenger seat, so her head actually hit the passenger window over on the side. Well, you can imagine an 80-year-old who's in a car accident that bad is going to have to go to the ER and is going to have to get a CT scan, which they did, which ruled out any brain issues. So that was fantastic. The thing is, she got a copy of the report, and in the report, it said that she had severe degenerative arthritis in every level of her neck. So Sue called me, and she was like, I need to get in right away. Of course, made room for her the next day on the schedule because obviously this is a traumatic issue. She's been cleared medically that there's nothing wrong, fractures or anything like that. We need to start that healing process for her immediately. When she came in, she brought me her report and she was more depressed than I've literally ever seen her. Now, mind you, you need to understand that Sue was an extremely active person. She would take her grandkids to school. She traveled for their sporting events. Like, she was not an 80-year-old, I'm sitting in my rocking chair not doing anything. She was hosting parties. She was very, very active. And I had never seen her so depressed. She was like, I don't think I can take my grandkids to school anymore. It was really difficult to see someone who I have been working with for years, who had a very vibrant lifestyle, all of a sudden turn into an old lady. And I was like, Sue, this is not you. I'll tell you what, you have been through something and I'm going to give you 30 days to get out of this. We are going to work on this. We are going to get rid of your pain. We are going to get you moving better. But in 30 days, you're going to be back at the gym. You're going to be doing Tai Chi. You're going to be driving your grandchildren around and you're going to be traveling for their sporting events because that's who you are and that's what you do. Now, I am happy to report that Sue did get to that point, and it was partly due to me and my help, but really it was due to her and her determination to get back her quality of life. The important thing that I want to point out here is that she had a report from a doctor that said that there was a significant problem. Now, the car accident did not cause the severe arthritis. It was there for years before that, and she was able to live an active, healthy, and confident lifestyle for years before that car accident. What I needed to do was work on her mental state to make sure she realized that the car accident did not cause the arthritis. It was there the day before the car accident. You were able to do all these things the day before, which means you will be able to do them again. And it is really important to work with a specialist who's able to talk to you on that level as well. Because I'm pretty sure that if she had seen anybody else, they would have seen a fragile, frail 80-year-old and said, oh, you shouldn't be traveling for sporting events. You shouldn't be hosting parties. You should be relaxing. But that wasn't her. That wasn't Sue. And if you met her, you would definitely understand what I'm talking about. It was important to get her back to her quality of life. And luckily, I knew what that baseline was, so I was able to push her towards it. All right, so what did I do for Sue that helped her get back to her level of activity? And what can you do right now? If you've been diagnosed with neck arthritis, you may be feeling very frustrated and super depressed as well. So I want to give you some tips and some really specific things that you can do. And I guarantee you can do them right now that are going to help. The first thing I want you to do is work on your posture. You need to have your head over your shoulders and your shoulders over your hips and your hips over your feet with your feet equal on the ground when you're standing. So you need to make sure that you're in good posture so that you're not putting increased stress on those joints. Now, I will say that some people are so kyphotic or bent forward that they are not able to get their head over their shoulders. If that's the case for you, then you need to find a specialist who is able to help you mobilize those joints and stretch those soft tissues so that you can get in that position. It is available for most people as long as it's dealt with early. Now, I have had some patients who have come in who are extremely kyphotic and they're almost kind of fused in that position. They tend to be older in their 70s and 80s by the time they get to this point. So if you're in your 40s and 50s and you're feeling like, oh yeah, I'm noticing a little bump on the back of my upper back, it's time to get help now. You want to make sure you deal with that now before it becomes a permanent problem. The next thing that you can do at home is work on your breathing. When you're breathing properly, you're using your diaphragm or your big inspiratory muscle. But when you're not using your diaphragm, you're using these muscles up here, which are called the accessory muscles of respiration. When you're using them, they get tired. When they get tired, they get tight. When they get tight, they compress the discs, which compress the joints, which leads to arthritis. That's why it is so important to breathe correctly. So I'm going to link a video here that'll take you through our breathing series. If you're not sure how to breathe correctly, definitely encourage you to go check that out. It's really helpful and explains step by step how to use that diaphragmatic breathing. Now, a lot of people ask me who have neck arthritis or have been diagnosed with neck arthritis, can I stretch my neck? Maybe. Okay, you need to stretch your neck gently. In fact, to start with, I prefer to do gentle active motion. Find a motion that's pain-free. It may be forward and backward, it may be rotation, it may be side to side. Most commonly it's rotation, but it may be forward and back. And do as much of that as you can, slow and steady, to get as much motion as possible. And then once you have full range of motion, then you can add in some stretching to decrease muscle tension. And the last thing I'm going to recommend, which I recommended for Sue and I recommend for all my patients who have neck pain, is cardiovascular exercise. It is important to get your heart rate elevated and get that good blood flow throughout your entire body to deal with any inflammation that's in your body. I don't care how you do it, but make sure you do something you enjoy doing so it's easy to stick with it for the long term. If you say, okay, I'm going to take up running, Dr. Amy, and you really hate running, chances are you're not going to stick with it. Do you like walking? Try that instead. Anything that you do regularly is going to have more of a long-term impact. So make sure it's something that you enjoy doing so that you'll see the benefit of it, and then you'll be motivated to want to continue. Now, the goal is to be doing 20 to 30 minutes of cardiovascular exercise every day, or at least 5 out of 7 days a week. And I know you may feel like I don't have enough time for that, but let me tell you, it will impact your pain, it'll decrease your stress, it'll improve your posture, and the benefits will be worth it in the long term. I know it's hard to carve out that much time, but once you do, I promise you, you're going to get addicted to it, and you're going to want to do it every single day. All right, now it's over to you. If you're wondering more about how all the body is connected, including cardiovascular exercise and posture and neck pain, I'm going to drop a link below that's going to lead you to the Amazon page that has my book. I highly recommend that you read it because it is actually really helpful to understand how the entire body is connected. In fact, one of my patients read it and she actually told me it was profound. So I'm taking that word profound and putting it out in the universe. Go check it out, buy it, read it, and let me know what you think. Drop a comment below. And if you want to know more about those breathing exercises, check out this video right here.